so it's Sam and Mike here from Balance My Hormones. Today we're going to talk about how to get TRT in the UK. There's the method of how you would go about it, and there's also, how you approach, a service healthcare practitioner to get it. So obviously you need blood testing, and you need to get that organised prior to having a doctor's consultation. Yeah. But there are a few ways in the UK to access it.
So in the UK, you could go to your NHS GP and ask for a blood test, or let them know that you've got symptoms
which is the starting point, isn't it?
Yeah, that you're not feeling right, and those symptoms might match up with low T or low testosterone. Now, invariably, the GP will tell you, here's an antidepressant, go home, or
that's true,
don't bother, or I'm not going to do the blood test for you. So that can happen.
I think what you mean by that is common symptoms of low, and we will talk about that in more depth, but things like anxiety, low mood, lack of sex drive, erectile dysfunction, things like that. Obviously, if you went to somebody who wasn't looking or knew about testosterone and looking for testosterone deficiency, they would treat the anxiety with what they would treat with, which is antidepressants.
If you're tired,
Viagra.
With Viagra, or if you're tired, they'll give you antidepressants. So that seems to be the go-to drug that's prescribed by the NHS. So if you don't want antidepressants, then I suppose you don't go to the NHS. But if you get beyond the gatekeeper, and if your GP is either in the know or sympathetic to you being on TRT, they may just order you a blood test. And if they order the blood test and the levels come back low and they are amenable to treatment, then they'll send you to the endocrinologist. And then you'll have a 6-month wait, maybe 8 months. And then you'll see the endocrinologist, and you may get sent back to your GP, who will say there's nothing wrong with you, nothing's wrong, and it's all fine. So then you're back at square one.
And that's because, the nature of, some people have got to the point of being and qualifying for NHS TRT, as it were, whatever they provide. But we talked about earlier, in a different video, about undecking away the libido and the options you often get provided for in the NHS. But I think the route that you get there, you said there's the gatekeeper, which is often a GP that, and again, TRT is not something doctors are trained in, through medical school. And even in acute care when they're training, it's not something they learn. They have to learn, and it's nothing against them. They've got to learn like every disease process and then apply it to every patient, and particularly in NHS where it's high demand and where a majority of your training happens. You might end up with a GP that doesn't know about it, like you say, or becomes scared when you mention something that they haven't heard about, and then you do either get pushed away, given an antidepressant or Viagra or a combination or something like that. Or if you do get to an endocrinologist, the same thing can happen.
Right? They might not be in the know either, the endocrinologist, half the time, or they'll refuse, or they'll have a certain set pattern in which they treat and won't treat. And then again, you're stuck either with a substandard treatment or something that doesn't make you feel quite right. And we see a lot of people that come through our service who had been to the NHS. And even though they can get it free on the NHS, they come to us. And they come to us, well, we can talk about the many different reasons, the high level of service they get, the attention, and essentially the experience of the doctors who are open-minded, and in many ways,
they know what they're doing with regards to that.
They follow more closely to the American style of TRT, but with British sensibilities in that regard.
Which is evidence-based, there are guidelines within the NHS.
It's evidence-based, but not the evidence-based of the very controlling, demeaning, only one-size-fits-all NHS evidence-based. It's based on all the evidence in the world, not just the cherry-picked evidence by NICE or the authorities who want to save money for the NHS.
It's a hard one because the NHS is, in its defence, right? Having worked there myself, and that's where I trained as a healthcare practitioner. It's cost versus efficacy in a lot of, has to be, because it's a funded service, right? So, but then the guidelines that they came out to help assist doctors in certain areas of practice became rules. and they're not regularly updated, and they don't look at the rest of the world, right, in terms of the most recent evidence that's come out, how people are practicing around the world. And I think that's, isn't it? But then there is that overruling control where there is no sense, there's no sensible attitude to look at evidence and actually consider.
Because they're told what to do. I mean, you could essentially, as much as we love our GPs, you can, you just have to train people to follow orders. And that's essentially what GPs end up doing. You look at an algorithm on a chart, whatever they're told to do, unfortunately their hands are tied, they have to do it. And the GP practices, so some of them are really private GP practices, but they have to follow all the NHS rules, don't they? In order to get the funding, they look seamless as if they are part of the NHS. And in some ways they are, and that's a whole other topic of how they're funded. But the end of the game is, they're looking
for cost savings, because they have to do that. So you might get to an endocrinologist if you can get through a GP. You might be bounced back. You might get therapy on the NHS. I mean, like I say, we've seen a lot of people come through to our doctors. Lots of high hematocrit on the Libido is what I've noticed. High red blood cell count, and then crashing really low levels. By sort of 5 or 6 weeks, things like that, which we talked about before.
What our service will do is help prepare all that for the patient, the client ahead of time in an all-inclusive way. So if you're thinking about getting TRT, the first thing to do is contact balance the hormones and get your bloods ordered, because we'll have you order the right bloods, the bloods the doctor's going to need.
Join us on our next video. We'll talk about our next topic. We'll speak to you later. Thanks.